Welcome to the AIDS Awareness Disc. This program asks 100 questions about HIV and AIDS. Don't worry, you probably won't know all of the answers when you start, but by the time you've completed the program, you will be AIDS aware.
What does AIDS stand for? Autoimmune deficiency syndrome, ancillary immune depression syndrome, acquired immune deficiency syndrome? No. AIDS stands for acquired immune deficiency syndrome.
What is HIV? A disease? A virus? A bacterium? A parasite? Incorrect. HIV is the virus that causes AIDS.
Which of our body systems does HIV attack? Muscular system? Immune system? No. HIV directly attacks the immune system, weakening the body's natural defenses against infection. The weakened immune system lets opportunistic infections such as pneumonia and some forms of cancer. How can you protect yourself from HIV and other sexually transmitted diseases? Use a condom, use a diaphragm, use birth control pills, any of the above. Sorry. You can protect yourself from HIV and other sexually transmitted diseases during sexual contact by using a condom. The condom and the dental dam are the only physical barriers that have been shown to prevent transmission of the virus. Which condom should you choose? Natural membrane condoms, latex condoms, lambskin condoms, any of the above? That's not right. For the best protection, use latex condoms. Lambskin or natural membrane condoms don't provide protection against HIV.
How effective are condoms at preventing the transmission of HIV? Almost 50%. That's not right. Although they're not quite 100%.
In a study, 123 people used condoms when they had sex with an infected partner. How many became infected? 100. Sorry. In a 2-year study of 123 healthy Europeans who used condoms every time they had sex with an infected partner, none became infected themselves. Although condoms aren't 100% effective, they can be very, very close if used consistently. When they fail, it's usually because they are
What is the best lubricant for condoms? Baby oil, petroleum-based lubricants, water-based? Incorrect. Only use water-based lubricants. Petroleum-based products actually break down the condom and can allow leaks or breaks to occur.
Can you get HIV from kissing? No. Yet that's not right. It has been known for years that a small amount of HIV may be present in the saliva of some infected people. However, the amount of HIV in saliva is much less than in blood, semen, or vaginal fluids. So, even French kissing has little risk for transmitting HIV.
Can you get HIV from oral sex? No. Only vaginal or anal intercourse transmits HIV. Only no. Getting semen, vaginal secretions, or blood from an infected person in your mouth puts you at risk of HIV infection. The risk is not as high as from anal or vaginal sex, but it is still there. Sores or cuts anywhere in your mouth would make oral sex even more risky. Can you acquire HIV by donating blood? Yes. Good. There is absolutely no risk of getting infected with HIV by giving blood because a new sterile needle is used for each blood donation.
A girl sneezes while scooping your ice cream and you find out she's HIV positive. Are you at risk? Yes. HIV. That's not right. You may catch a cold or other virus from her, but you won't catch HIV. HIV is a blood-borne.
Which of these activities would you consider to be high risk? Sharing a cigarette with a friend? Sharing an intravenous drug needle with a friend? That's not right. Never share intravenous drug needles. HIV is a blood-borne virus, which means that it lives in blood. If your friend is HIV positive, small particles from her blood can remain on the needle. If you are an intravenous drug user, what can you do to reduce the risk of acquiring HIV? Never share needles and syringes. Kick the drug habit. Use condoms. All of the above. Incorrect. All of these things will reduce your risk. Of course, the best way to reduce your risk is to kick the drug habit entirely. If you can't, don't share your needles and syringes. This minimizes the chances that someone else's infected blood will be injected into your. How is HIV transmitted by sharing intravenous drug needles? Blood stays in the needle and is injected into the next user. The needle sticks allow airborne viruses like HIV. No. Blood from a previous user can cling to the needle, where it is injected into the next user. Since HIV is a blood-borne virus, the blood that remains on the needle may contain HIV.
Sean shares an office with a woman who is HIV positive. Should he be worried about becoming infected? Only if they have unprotected sex or share intravenous drug needles. Yes, HIV can be transmitted through the air. Incorrect. The office is like any other place Sean spends his time. If he engages in high-risk activities like having sex without a condom or sharing intravenous drug needles, he should be worried about becoming infected with HIV.
What is one way you can become infected with HIV? Working with an HIV positive person. Sharing the bathroom with an HIV. Incorrect. If you use intravenous drugs, you can become infected with HIV through a contaminated needle. Working with or sharing the bathroom with an HIV positive person does not put you at risk of acquiring the virus.
Which of the following is no longer a main cause for HIV infection in the U.S.? Sorry. HIV is rarely transmitted through blood transfusions. Although we hear of people who became infected with HIV through blood transfusions, most of them were infected prior to 1985. Today, extensive screening programs are used to detect the presence of antibodies to HIV in the blood supply.
Can dogs or cats carry HIV? Yes, but they can't get AIDS. Yes, but they can't transmit it. No, only humans carry HIV. No. HIV is a human virus. It cannot survive in other animals. There are similar viruses such as feline immunodeficiency virus, or FIV, which.
What does it mean to be HIV positive? Antibodies to No. The term HIV positive means that antibodies to HIV have been found in a patient's blood. These antibodies are produced by the body's immune system in an attempt to fight off the infection. In most.
You've answered 20 questions so far. Learning anything new?
How can you tell if someone is HIV positive? They exhibit the symptoms of AIDS. They are required by law to disclose their condition. That's not right. You can't tell whether a person carries HIV. Many people who are HIV positive carry the virus for 10 years or more without exhibiting any symptoms.
If you are HIV positive, which of these activities should you avoid? Talking with friends, eating in public restaurants, donating blood. Sorry. HIV positive people must not donate blood. Since HIV is a blood-borne virus, the donated blood could not be used. Casual contact does not allow the transmission of HIV, so there is no reason an HIV-positive person should avoid contact with others. Can you tell if someone is HIV positive by their appearance? Yes, HIV patients are thin and weak. Yes, but only after they have been infected for 6 months. No, people with HIV may look and feel fine for many years. That's not right. People with HIV may look and feel fine for many years after being infected. In fact, HIV can live in a person's bloodstream without causing any symptoms. Which of the following statements are true? People who are HIV positive have AIDS. Symptoms of HIV infection develop immediately. Many people don't show signs of HIV infection for years. Incorrect. Many people don't show any signs of HIV infection, particularly in the early stages of the disease.
How can a baby be born HIV positive? Through poor prenatal care. The virus can be passed from mother to child. Hospital personnel can infect the child. No. The virus can be passed from mother to child during pregnancy. That's why it is so important for HIV-positive women to avoid getting pregnant.
George's HIV test was negative. How can he confirm his results? Repeat the test at another lab. Repeat the test after 2 weeks. Repeat the test after 6 months. Ask his recent sexual partners to be tested. No. To be sure, George should repeat the test after 6 months. During the 6 months between tests, George must avoid high-risk behaviors such as unsafe sex and intravenous drug use.
What kills most AIDS patients? HIV infection. Sorry. The weakened immune system can't fight off opportunistic diseases and infections like cancer and pneumonia. These diseases eventually kill many AIDS patients.
What is an opportunistic disease? A disease that is caused by HIV. A disease that infects the body when the immune system is weak. An infection that is acquired if you engage in high-risk activities. All of the above. Sorry. An opportunistic.
Among men and women between 25 and 44, how deadly is AIDS? It is in the top 20. Sorry. As of 1993, AIDS was the leading cause of death for women and men between 25.
When were the first cases of AIDS reported? 1950? That's not right. The first cases. How are HIV and AIDS different? They are incorrect. Which of these can carry HIV? A cat? No. HIV or human.
Is it possible to carry HIV and still look healthy? Yes. No. You cannot tell whether someone is carrying the virus.
How do opportunistic infections affect AIDS patients? The weakened immune system. Sorry. HIV attacks T4 cells, weakening the immune system. The weakened immune system isn't able to fight off opportunistic diseases and infections, like pneumonia and some forms of cancer. It is these diseases, not AIDS.
What causes AIDS? Promiscuous behavior, homosexual relations, a contagious virus, poor hygiene. Incorrect. AIDS is caused by a contagious virus. A virus.
Is HIV targeted to certain racial or social groups? Yes, only low-income people. Sorry. HIV does not discriminate on the basis of race, ethnic, or social.
Why aren't blood transfusions a main cause for HIV infections in the U.S.? All blood is filtered prior to transfusions. A screening program protects. Extensive screening programs were instituted in the United States.
Is it safe to eat at a restaurant where the chef is HIV positive? That's not right. HIV is not transmitted. Which of these is a high-risk activity? Swimming? Incorrect. The only activity on this list.
3 years ago, Bob had unprotected sex with a prostitute. Is it safe for him to donate blood? Yes. No. Before he donates blood, Bob should have a negative HIV test. If he tests negative and is not engaged in...
You've finished 40 questions so far. Some of these answers are surprising, huh?
Is it possible for an HIV-infected person to have a negative HIV test? Only if the lab makes an error. No, the tests are 100% accurate. Yes, if he or she wasn't. No. It is possible to get a false negative HIV test. HIV tests look for antibodies to the virus. Your friend Mike tests negative for HIV. Can he be sure that he is not infected? No. HIV test only good. HIV test.
Your friend is HIV positive. How should you protect yourself? Stop socializing. That's not right. You shouldn't have unprotected sex with anyone, including a friend who is HIV positive. HIV is passed from one person to another. Joan and Bill want to have intercourse, but they don't have any condoms. How can they protect themselves from HIV? If Joan is on the pill, they are safe. Incorrect. The only way Joan and Bill can protect themselves from HIV is to use a condom every time they have sexual intercourse. Other forms of birth control are not effective at blocking HIV. Even during oral sex, HIV can be transmitted from one partner to the other. Which of these statements is true about condoms? Use Vaseline to lubricate the condom. Store condoms in a warm, dark place. No. Never reuse a condom. Store your condoms in a cool place and never use petroleum-based products like Vaseline.
How many condoms are tested for breakage in the United States? 1 in 100. Perfect. Every latex condom manufactured in the United States is tested for defects before it is packaged.
During sex, when should you put on a condom? As soon as erection occurs and before any sexual contact. Immediately before penetration. Up to 6 hours prior to intercourse. Any of the above. Incorrect. Put on the condom as soon as erection occurs and before any sexual contact, including vaginal, anal, or oral sex. HIV can be in semen and vaginal fluid.
What should you do if your condom breaks during sex? Stop and put on a new condom. Continue and use a new condom the next time. Insert a spermicide into the... Never continue using a condom if it breaks during sex. Stop and wash with soap and water, then put on a new condom. Spermicides and douches have not been shown to kill HIV in the vagina.
Which is the best lubricant to use with a condom? Incorrect. Use only water-based lubricants.
Which of the following can weaken a latex condom? Oil-based lubricants, exposure to heat or sunlight, age, all of the above. Correct.
Which types of contact can transmit HIV? That's not right. HIV can be transmitted through oral sex. You cannot get HIV by holding hands or even kissing someone who
Can you get HIV from playing sports? That's not right. Based on current knowledge, the risk of getting HIV while you play sports is very low. This is because most sports don't involve contact likely to cause bleeding.
How can a woman avoid transmitting HIV to her unborn children? Avoid conception if she is HIV positive. Use proper prenatal care. Correct.
Is it possible for a baby to be born with HIV? Yes, if the mother is infected. Yes, if personnel in the hospital are infected. Yes, no. The virus can pass between the mother and the baby before birth. This is why it's so.
If you discover that you are HIV positive, who should you tell? Previous sexual partners? Anyone with whom you've shared drug needles? Future sexual partners? All of the above? Sorry.
If you have HIV, how can you protect others? Don't donate blood. Don't share intravenous needles. Don't have unprotected sex. All of the above. Sorry.
Which of these fluids can sustain HIV? Drinks like water and coffee. Intravenous drugs. That's not right.
What is an important component of any AIDS prevention program? Immunization, education, That's not right. Once we are educated about HIV and AIDS, what is one way a person can become infected with HIV? Sharing intravenous needles, bathing in heated public pools, being bitten by an HIV-positive cat. Incorrect. Since 1989, what is the fastest growing group of people? Sorry.
You've finished 60 questions today. Learning anything new?
Can HIV pass through latex condoms? Yes, there are tiny holes that allow good.
What is the best way to put on a condom? Hold the tip and unroll it onto the penis. Put it on the penis with no space at the end, then unroll it. Unroll it, then pull it onto the penis like a sock. Any of the above will work. No. Hold the tip of the condom and unroll it onto the erect penis.
Why aren't petroleum-based products good lubricants for a condom? They don't lubricate as well as water-based lubricants. That's not right. Lubricating condoms with petroleum-based products like Vaseline. A girl in your class is HIV positive. What should you do to protect yourself? Don't share. Incorrect. Don't have
Blood transfusions are no longer a main cause of HIV transmission. Why? Complete testing of the blood supply. An additive is placed in blood to cleanse it. Sorry. Blood. Outside a medical lab, how long can HIV survive once it leaves the body? Only a few seconds? 3 to 6? That's not right. In normal concentrations, HIV.
Is it possible to acquire HIV during a one-night stand? Yes, any sexual contact can transmit the virus. No. Any sexual contact can transmit HIV. During sex,
What is the biggest cause of HIV infection among women? Intravenous drug use. Unprotected sex. No. Through December of 1990.
What does anonymous HIV testing mean? Your social security number is used for identification. You have control over access to your test result. Your results are not reported to public health officials. Sorry. An anonymous HIV test means that you have control over access.
Which of these diseases is spread the same way as HIV? Hepatitis? That's not right. Hepatitis and HIV.
Which of these is a high-risk behavior? Having oral sex? Sharing intravenous needle? That's not right. Having oral sex, sharing intravenous needles, and having unprotected.
What is a high-risk behavior? An activity that allows you to touch an HIV-positive person. An activity that puts incorrect. A high-risk behavior. If you don't have a condom, what is a safe way to enjoy sex? Oral sex? No. Mutual masturbation is really the only safe way to enjoy sex without using a condom. HIV lives in bodily fluids like blood, semen, and vaginal fluids. During oral and anal sex, these fluids can come into contact with your bloodstream.
Can condoms expire? No, since they are made of latex, they last. Incorrect. There is an expiration date. What is safe sex? Using a condom during sex. Having sex with someone you've known for a long time. No. When it comes to AIDS awareness, safe sex means. Where can you get an HIV test? Your doctor, your county health facility, a medical clinic, all of the above. Sorry. What should you do if a condom comes off during sex? Douche immediately. Stop, wash, then get. That's not right. If a condom comes off during.
Can you get AIDS from a toilet seat? No, the virus will. Sorry. You cannot get HIV from a toilet seat. Is it safe to shake hands with an HIV-infected person? That's not right. It is safe to shake hands with an HIV.
You share a locker with an HIV-infected classmate. Are you at risk? No, HIV is not. Incorrect. It is safe to share a locker with an HIV.
That's the 80th question. Keep going.
An HIV-positive classmate has a bad cold and sneezes. Are you at risk? No. You find out your best friend is HIV positive. What should you do? Stop speaking to your friend? Tell your other friends immediately. Sorry. You should provide support to your friend.
How is HIV harmful to the immune system? HIV reproduces within infected T4 cells. HIV dies in the bloodstream, leaving unhealthy residue. No. HIV attacks T.
What does unsafe sex mean? Having sex without a condom. Having sex. Sorry. The term unsafe sex.
Sue and Jim have decided to have sex. What should they do first? Discuss their sexual histories? Have HIV test? Put on a condom? Incorrect. Which bodily fluids carry enough HIV to allow it to pass to another person? Semen, blood, and tears. Blood. Sorry. HIV is a blood-borne virus that can survive.
Should people who are HIV positive be excluded from schools and businesses? Yes. This is the only way to stop the epidemic. Incorrect. We shouldn't exclude people with HIV.
What does HIV stand for? Hyperimmunodeficiency. Incorrect. HIV stands for Human Immunodeficiency Virus.
Which term best describes diseases that threaten the lives of AIDS patients? Epidemics? Viruses? Perfect.
What are some of the symptoms of AIDS? Weight loss? That's not right. Symptoms.
Do sexually transmitted diseases affect your risk of getting HIV? No, they are unrelated. No. Some sexually transmitted diseases.
Who has the highest risk of exposure to HIV? Incorrect. We are.
Which statement best describes AIDS? The most contagious sexually transmitted disease. A disease that weakens the immune system. An outcome of promiscuity. That's not right. AIDS is a disease that weakens the immune system. What is the first step in acquiring AIDS? The patient becomes weak. The patient's T4 cells incorrect. First, a patient is
What is a T4 cell? A virus that causes AIDS. Incorrect. The T4 cell. What does HIV do when it attacks T4 cells? It produces antibodies that weaken the immune system. It kills. No. HIV attacks T4 cells.
HIV can live in which of these fluids? Sorry. Can spermicides kill HIV? No, that's not right. Studies show that. Does a person who is HIV positive become more contagious over time? Incorrect.
What are ELISA, IFA, and Western blot? Tests used to monitor the progress of AIDS. Tests that identify different types of HIV.